Today we have with us Sarah Millam. She is the Pennsylvania MEDI local coordinator of Chester County Department of Aging Services. What we are going to talk about today is something that every senior needs to know. If you are a senior approaching your 65-year birthday, or if you have somebody in your family that would be approaching their 65 birthday, you need to watch this because Sarah is going to share with us different Medicare programs that are offered nationwide in the United States. Now, different states may have some variations, and Sarah is from Chester County, so she will talk about how it is done here. But Sarah, would you say that the program is pretty much identical nationwide?
Yeah, it is. It's referred to as SHIP nationwide, which stands for State Health Insurance Assistance Program. So anybody can look up the state program for them in their area.
Sarah, thank you for that information, and I really appreciate you joining us today. So why don't you tell our audience who you are and what this Medicare programs are, and there are some A, B, C, D divisions of the parts of the Medicare,
Yes.
And when they can start looking for it and sign up, and who should they call?
Okay, great. Well, thank you so much for having me on your show. I really appreciate it. It's nice to be able to get the word out about Medicare counseling. So my name is Sarah Millam, and I work for the Chester County Department of Aging Services, and I am the local coordinator for Pennsylvania Medicare Education and Decision Insight, also referred to as PA MEDI. It was formerly known as a prize, and that's what people might know it as. It was changed July 1st of 2021. We were rebranded, and the reason that we were rebranded was because the Pennsylvania's Department of Aging, the Education and Outreach Office, administers PA's SHIP, and each year they receive SHIP customer satisfaction survey, and the survey showed a high level of satisfaction with interactions with the APPRISE program. However, it also identified an overall lack of public awareness of the program, low name recognition, and a low correlation between the current program name, which was APPRISE, and the purpose of the program, which is the Medicare Education and Counseling. So it is now Medicare Education and Decision Insight, also known as PA MEDI. Nationally, it's SHIP. So this is a program that is throughout the United States as well. And so in Pennsylvania, the program serves locally through Pennsylvania's 52 area agencies on aging. We're supported by nearly 600 volunteers nationwide, statewide, currently serving over 250,000 of Pennsylvania's 2.7 million Medicare beneficiaries. So what is Medicare? Medicare, it's a federal health program. It's for people age 65 or older, and also people who are under 65 with certain disabilities. So PA MEDI, there are 30 counselors in Chester County, and we offer unbiased, free, personalized counseling to people who want to learn more about Medicare. So we also interpret Medicare rules. We address coordination of benefit issues. We help enroll eligible beneficiary into public programs. We assist with plan enrollments, and we assist with filing appeals. So when you get near your 65th birthday, so the 3 months before your birthday, the month of your birthday, and the 3 months after is called your initial enrollment period. And that is a time that you can enroll for Medicare. Another time to enroll would be if you're continuing to work, then you can do a special enrollment period to enroll in Medicare after your work coverage ends. So we offer different ways for one-on-one counseling. So right now, because of COVID, we're doing counseling by phone or via Zoom. The senior centers are getting ready to open in Chester County. They're going to be open in, some of them are opening in September. The Oxford Senior Center is open, so they are offering in-person counseling right now. So once the senior center is open, then we'll be able to offer some in-person counseling.
And are there any senior centers that are open in our area?
Yes, the Oxford one is open now.
Okay. And others are opening.
And the other ones are going to be opening in September, like Kenneth Square, the Brandywine Valley area of agency. I'm not sure exactly when Westchester Senior Center is opening. Phoenixville Senior Center is opening. So they're getting ready to open. And I think Surrey Services as well. So then hopefully we'll be able to do some in-person counseling. Hopefully this variant won't interfere with that.
Right, absolutely. Yeah, that has been brutal.
Yeah, it has. It's really kind of thrown a wrench in things.
Yeah.
But the counselors have really stepped up to the plate and have been great with the phone counseling or doing counseling via Zoom. That has worked out well as too. We also offer presentations. So through the libraries and the senior centers, we're offering, we offer 3 different kinds of presentations. The first presentation is a Medicare 101 presentation. And so that's for people who are new to Medicare. And we present a nice overview of Medicare, including the definitions of Medicare, the ABC, explanation of the drug benefit, which is Part D. We talk about the different types of healthcare insurance available in Chester County and benefits available for low-income beneficiaries and things to consider when selecting your Medicare coverage. We also, so right now, these presentations are offered via Zoom. We also offer a Medicare 102 presentation, which is mainly for people who have Medicare and kind of want a review of the benefits and preventative services that Medicare offers. And that presentation goes a little bit into fraud as well. And then we offer a Medicare update, which reviews the basics of Medicare and talks about the changes that you can make coming up for the following year.
And how often can the changes be made?
So there's a period called the annual open enrollment. And that is from October 15th to December 7th. And that is when you can make changes. You can go back into original Medicare, you can switch prescription drug plans, or you can switch Medicare Advantage plans. Now, when you do the switch between October 15th and this December 7th, it won't become effective until the next year.
Oh, okay.
So, yeah, so the Medicare update is great. It'll talk about the different changes that are going to be occurring in the next year. People definitely want to do maybe some one-on-one counseling during this time as well. The counselors will go on to the Medicare Plan Finder, enter prescriptions so that the beneficiary can know exactly what plan will be good for them in the following year.
Right. I'm sorry. And the information below on under the screen shows how they can reach you. There's an email, phone number, website, and they can also reach out to any of the senior centers. Now, you mentioned that right now only one or few senior centers are open, but they can certainly reach out by calling or emailing you or visiting your website, correct?
Yeah, absolutely. And my email is on, I think that's on the
Yeah,
screen as well.
it's on this.
Mhm.
Yeah, yeah.
Yep. And our helpline is a great option as well. There's somebody during business hours that's always manning the helpline, and you can call with any questions. You can call and find out when our presentations are. They are throughout the year. And you can schedule an appointment for a one-on-one counseling session as well through the helpline, or just, ask a general question.
Right, right,
But we're definitely there to help people. We want to help people understand this
right.
confusing.
Yeah, and Sarah, you mentioned earlier about people who are approaching their 65th birthday
Mhm.
can reach out 3 months prior to the month they were born in,
Yes, they
and
can. They can reach out and
and also 3 months after the month they were born in.
they can, yes. Now, the 3 months after, when they enroll in Medicare, it actually can be delayed. The effective date can be delayed by a couple of months. It just kind of
Okay.
depends on when they're enrolled. So that's another thing that just makes this program confusing, and it's great to have a Medicare counselor.
So what is the best time frame for people to enroll if they're approaching their 65th birthday?
Well, those 3 months before is a great time to enroll, because then it will start the month of their 65th birthday.
Right,
If
right.
their birthday is the first day of their 65th birth month, Medicare will start the month before.
Oh, okay.
Yeah, and for those who are continuing to work,
Uh-huh.
they could sign up for Medicare Part A. Now, if they do have a health savings plan, they do want to delay entering into Part A because there could be tax consequences, because you have to be in a high deductible plan. But people who continue to work will have a special enrollment period to sign up for Medicare, so they won't be penalized.
Right. And now, when they call you, you will be able to guide them as to what plan to sign up for, and based on their needs, are you able to recommend any plans, or how does that work?
Well, what we do is we give unbiased free information. So
Right.
we are there to educate them. We give them the information. We can give them different what the different premiums are for different plans. We'll talk about Medicare Advantage plans. We'll talk about Medigaps.
Mhm.
We'll talk about all the different parts of Medicare, so they can make an informed decision. And
Right.
we're not getting paid by anybody, and we don't, guide them towards any particular company or anything. We're there to give them information so that they can make a good decision.
Right, because when somebody's turning 65, they start getting bombarded with mails and calls from people claiming to be agents or brokers, and
Yeah.
so before they make any decision, they should talk to you.
Yes, they can, absolutely. If they could call us and talk to one of the counselors, or call a senior center and talk to one of the counselors, yeah, that will be ideal. Then, it gives them information, and we don't put any pressure on them to go towards any particular plan or anything.
And then you mentioned something about if they are working. Now, when you working, meaning are they getting medical benefit through the work, or if they're in business for themselves?
Yeah, if they're already getting benefits through work, they can continue to get those benefits, and they can sign up, when they retire, when their benefits stop, they can then sign up for Medicare. And they have to fill out a couple of forms just to show that they've had what's called credible coverage, and then they will not be penalized for joining Medicare outside of their initial enrollment period, which is that 7 months when they turn 65.
Absolutely. And you also mentioned something about tax liabilities. So for that, do you offer advice, or they should contact their tax advisor?
Yeah, they should definitely contact their tax advisor
Right,
for
right.
that. We just, when they have a health savings account, if they join Medicare, yeah, Medicare is the wrong. They have to have a high deductible insurance to have a health savings account. So, yeah, that can be a little
Right, right, right.
complicated. So,
Yeah. So, Sarah, there is a lot of good information for people to uh, digest, and uh, I'm so glad you have so many resources available to guide them.
mhm.
Let us just review that one more time. Uh, they can reach out the Chester County PA helpline at 610-344-5004, option 2. And they can reach the Chester County's Medicare education website that is displayed on this screen. And then there is their email, smilam@chesco.org.
Yep. And that email is my email. So I
Yeah,
can help
right, right.
them.
Yeah, and uh, they can also reach out to you for participating in one-to-one workshops or presentations that you hold at
Mhm.
libraries or senior centers.
Yes.
And
And they can even, if they want to volunteer for the program, they can reach out to us if they want
oh,
to
that
volunteer
yeah,
as well.
that
Hmm.
would be great. Somebody who has experience in Medicare, or just even without experience, you will show them how to do it, right?
Yeah, yeah, it's a great volunteer program. It's you really get a lot of satisfaction helping people
Yeah,
navigate the system.
right, right, right. So we do this weekly show to spotlight local small businesses and community organizations, amazing organizations like you that make the life of people living in the community, working in the community so much better. And I really appreciate you joining us today. Before we say goodbye to our audience, is there anything you want to share with them?
Just yeah, please give us a call. It's a very confusing system. We also have help for low income individuals. There's some programs, extra help, the Medicare savings program that might be able to save low income individuals some money as well. And we also help people apply for Medicaid as well.
Right, right. So with that, I want to tell our audience that if you are a small business or a community organization and you would like to be on our show, please reach out to me on the contact information is coming up on the screen, and we do this show every Saturday at 10 o'clock. Thank you for watching, and we'll see you next Saturday at 10. And thank you, Sarah, for joining us today. Really appreciate you taking the time off from your busy schedule.
Thank you, Bipin. I really appreciate the time to talk about PA MEDI today. Thank you so
Great.
much.
Thank you. Bye bye
Thank
now.
you. Take care. Bye
Sure.
bye.
Bye. Bye.